Treating the rising number of COVID-19 cases will put immense pressure on our healthcare system. And that's why you've been hearing the term flatten the curve.
Governments across the globe are scrambling to contain the spread of COVID-19. Now, you may have heard experts talking about efforts to flatten the curve. But what does that actually mean?
To talk about some of the things that each of us are supposed to be doing to help flatten the curve as we continue to hear about.
If Canada is to succeed at delaying the outbreak and flattening the epidemic curve, we will all need to bring our best game.
And that game's playbook is all about keeping people apart, as well as locating and isolating the sick.
I'm not a medical expert, but as a meteorologist, I do look at charts, graphs, and use data every day, so I'm a little familiar with numbers. But even when I started hearing flatten the curve about a week ago, it took me a few times to figure out what it all meant.
As the U.S. is attempting to flatten the curve, the infection curve.
You may have heard a lot about flattening the curve, but what does that mean?
If we all take the measures that we are within our power to take, and we spread out how the disease happens, and we flatten the curve. And the really great thing about this is the difference between the two curves isn't waiting for a vaccine, it isn't waiting for a new drug.
And that's where the phrase flatten the curve comes in, says UC San Diego health economist Jeff Clemens.
So one way to think about the health system is that it's there to manage the flow of patient health needs across the population in the same way that a drainage system is there to manage the flow of water that comes from storms.
Ideas like flattening out the curve, yes, that positively impacts the survival of individual humans, but more importantly, it means that the economy can continue to operate. A decision by, for example, the UK government to say we recommend that businesses and gathering places and theatres shut down without mandating it means that insurers are not obligated to support businesses that will now lose their income, perhaps forever. It's a very interesting time, and what a time to find the kind of leaders that we have. I'm talking mostly about Anglophonic countries.
Fill in the valleys and level the mountains and hills. Straighten the curves. That's really the verse that got me this week. Straighten the curves and smooth out the rough places. Then the glory of the Lord will be revealed, and all the people will see it together. I want to take a few moments today, and in light of what's going on around the world, this pandemic known as coronavirus, I wanted to preach from the subject, flatten the curve. Flatten the curve. I think it's a fitting title today.
The two things that people have heard the most about at the moment, social distancing and flattening the curve. Can you just explain both and why they're important right now?
Yeah, so the virus takes advantage of the fact that we are social animals, that we assemble in groups, that we have friends, that we touch each other and hug each other, and it uses those connections that we assemble ourselves into these networks. It uses those connections as a highway to travel through our species. And so the challenge for us right now is how to interrupt that highway, how to break the paths that the virus uses to travel from person to person to person to person. The reason that's important is that this flattening the curve idea. So we're going to engage in social distancing. We're going to stop interacting with each other. We're going to keep physically apart from each other. That's the most important thing. In fact, I've been advocating for a shift in terminology to physical distancing from social distancing. In other words, we can still interact socially, but from a distance, like you and I are doing now.
Right.
And so we want physical distancing. The irony is we want to bond together at the same time as we are sort of separating from each other in terms physically. Anyway, the reason we're engaging in that physical distancing is to cut the paths through the network. And the reason we're doing that is to flatten the curve. What does that mean? Well, it's an epidemic that's coming to us. It's this wave, a pulse of the virus as it's spreading from person to person and growing exponentially. And the reason that this is very important is that, let's say, for the sake of argument, 100,000 Americans are going to die of this condition in the next year. It makes all the difference in the world whether those 100,000 die over the course of the next year or whether all 100,000 die in the next month. If they die in the next month, they're going to overwhelm our healthcare system. And many more Americans will die than would have died if we allowed our healthcare system and our supply chain to work. So we want to flatten the curve. We've got this peak of a curve where everyone, the epidemic is coming at us and it's going to hit lots of people at the same time. We want to stop it from doing that and flatten the curve and push it out into the future. And when we do that, we achieve a number of objectives. First of all, at any given point, fewer people are sick, so our healthcare system can take care of them. Many more might live as a result of that. Second, we push some of the cases out into the future so that maybe some of the people that get sick eventually will get sick at a time when we've invented a vaccine or we know better how to treat the people. So we also gain that benefit by flattening the curve. And as I said, not only do we decompress our healthcare system, not only do we push people into the future when we might be better able to care for them, but we reduce mortality as well. So maybe instead of 100,000 dying, maybe 90,000 die if we push it forward. So that's why we're social distancing, and that's what flattening the curve means.
So I guess the obvious follow-up then is, do we have any evidence that the things that we are doing at the moment or being told to do is working? Is the curve being flattened?
We cannot know yet because we have not had adequate testing in this country. We don't have adequate surveillance like they did in China and Korea. And so we really can't be sure. We know that this type of behavior, this social distancing behavior, the banning of public gatherings, the closure of schools, the reduction in group size, the self-isolation, we know that that works from other epidemics, but we cannot yet know how much it's working in the United States right now because we don't have the kind of surveillance we need to see it.
Andy Samberg, tonight.
America's new normal. We are dealing with a crisis that we have never seen in our lifetime.
Do not send your children to schools.
No one should be on the streets. The healthcare system braces for the worst.
It wasn't like any sickness that I've had before.
I felt like I had a belt around my chest.
We're seeing a lot of people just kind of freaking out.
Borders closing. Public spaces and stores emptying out. Officials scrambling to respond.
Nobody knew there'd be a pandemic of this proportion.
Markets tumbling. Businesses closing.
We need help now.
It's like a nightmare that doesn't end. Families hunkering down. This is our reality for the next 3 weeks. How bad will it get?
It's been very frightening.
This is a character test for all of us.
This is an NBC News special report. The coronavirus pandemic. Good evening, everyone. Welcome tonight. A special look at what has suddenly forced its way to the forefront of all of our lives. One of the biggest crises we've ever faced, the coronavirus pandemic. Over the next hour, we will bring you the latest on the outbreak, and in collaboration with Facebook, we're going to be answering some of the questions most important to you. What concerns you most about the coronavirus pandemic? Go to our Facebook page to weigh in, and our panel of experts will answer your questions throughout the hour. We're all in new and uncharted territory. Just tonight, Governor Gavin Newsom of California, the biggest state in the nation with nearly 40 million people, has issued a stay-at-home order for the entire state. This is the new normal. We'll go to Jolene Kent now in California with more on that breaking development.
Lester, that's right. This has just been issued in the last hour, and the whole idea of this stay-at-home order here in the state of California is to prevent and stem the spread of COVID-19, known as coronavirus. What we know is that the stay-home order starts tonight. It goes through April 19th, and it requires the closures of malls, playgrounds, non-essential businesses to shut down starting tonight at midnight. However, if you do have gatherings of between 2 and 9 people, those can be in a confined space, in a private space, say in your home. The other good news is, because we are in California, you can still go for a walk. You can go to the grocery store, to restaurants, as long as you're practicing 6 feet of social distancing. So this is something here in Los Angeles we've already seen come over this time, but this does begin at midnight. It starts tomorrow.
All right, Jolene Kent with that late breaking news. Thanks very much. And so this is our new normal, except it's not normal.
We direct a statewide order for people to stay at home. That directive goes into force and effect this evening, and we are confident that the people of the state of California will abide by it.
We're living through a time unlike any other in American history. Tonight, the nation is facing a mind-boggling array of unprecedented challenges. There's risk to lives and livelihoods. The coronavirus pandemic and the resulting economic fallout have Americans frightened, anxious, and confused.
In my lifetime, I've never seen anything like this. And in everybody's lifetime, this is unprecedented, not just for us, but in the history of our country. This is something that's never happened.
NBC News medical correspondent Dr. John Torres.
People's lives are going to be affected, not just from a health perspective, but from a financial perspective, a psychological perspective, and economic perspective.
Nearly every American has been directly affected in some way. Major cities essentially shut down.
These dramatic disruptions to daily life keep reverberating from coast to coast.
NBC's Stephanie Gosk.
Things shutting down that just a couple of weeks ago would have seemed unimaginable, from wine country in California to the casinos in Vegas.
Millions told to shelter in place. Among those hardest hit, hotels, bars, and restaurants. Derek Thompson of The Atlantic says owners and employees are beside themselves.
They're absolutely terrified, and they should be.
The industry sees job losses of 5 to 7 million in just 3 months. There are so many new jobless claims that some states' websites have crashed at times. Nationwide, the number of confirmed U.S. coronavirus cases has surged. The tri-state New York metropolitan area has more than 5,800. But as Governor Andrew Cuomo said, that's because more people are being tested.
But it doesn't mean that that's the rate of increase in society.
Still, one of the biggest concerns is new research showing the threat to younger people. NBC's Tom Costello.
Some very important news from the CDC. 40% of the people who are hospitalized are actually younger people, 20 to 54.
And in one large New Jersey family, unimaginable tragedy. 7 members of the Fusco family contracted the disease. 4 of them, the mother and 3 children, have died. 3 others are hospitalized.
What that highlights is just how contagious this disease is, just how deadly this disease is.
Another major concern, the chance of exposure to healthcare workers. Dr. Frank Esper of the Cleveland Clinic.
We're trying to prevent sickness from coming to the healthcare provider, because if we get sick, then there may not be enough people to treat the individuals who are coming in sick.
NBC News analyst Dr. Erwin Redlener.
We need gowns, we need face masks, we need goggles, and we need and gloves, of course.
Today, the total number of deaths in Italy surpassed those in China, which was where the pandemic started. But there was some possible good news. The Chinese government said there were no new local infections in China for the first time since the pandemic began 4 months ago, a possible signal that draconian containment measures there have finally taken hold. That draconian containment measures there have finally taken hold.
A simple message that could have a big impact on that all-important curve.